Right. Well, we didn't call it cyberbullying, but in the Bible, there's a lot of persecution
Right.
that goes on, all the way back to Cain and Abel.
Right.
In the very beginning, one brother hating another brother because of his talents or skills, and that creates a persecution, or what we want to call bullying. Then we have David, who was persecuted by his brother and sought after, because of his inner problems that Saul had. And through the Bible, we find, even when Jesus was persecuted, because they didn't like his religious belief. They wouldn't accept his desire to love those and to heal and deliver. There was jealousy. The priest then, because they said, "What is he doing this? And how is he doing it? Why is he doing it?" And these are things that create bullying as a means of silencing people who you don't like, or persecuting them because you want to have power over them. And so bullying is in those areas.
Right, exactly. You made a point there that it's coming from a position of power and trying to be stronger and influence someone weaker, whether it's financially or physically. With today's technology, cyber, it's not necessarily financially or physical. It could be through technology, through the written word, via instant messages, social networks, or through texting. We also have instances where individuals take pictures of themselves, or someone takes a picture of them, and then they send this picture out onto the internet and it becomes viral. And now that picture of the individual that could be in a compromised position, doing something they shouldn't be doing, or doing something that's supposed to be behind closed doors, now the whole world, because this is something that the entire world can see. We have examples where individuals, they had a wonderful career and they made poor judgment, not realizing that something that they did and they put online went back, and their bosses or they end up losing their career. There's an example in Brooklyn where a teacher lost their job. We have other examples throughout the country where people are just losing careers because of just poor judgment.
Right.
You have to be wiser, and these are the adults. So imagine with the kids, their judgment's even going to be, not I'm going to say just poor judgment, but it's not going to be as at the level of an adult. So we have to be really careful of what's going on.
And Dr. Brian, it's sad because the cyberbullying has led to some suicides. And
yes.
I know you were sharing us something that happened most recent that I didn't even know about.
Right.
You might want to share with our viewers.
Right. Well, we have. We're starting to see a spike of suicides, teenage suicides, and that's what this show is about. But this is just basically an introduction. We'll do a suicide, cyberbullying part 4, suicide 2, where I'll have an expert that will really sit down and go over suicides. But we're starting to see a spike where suicides are directly related or linked to cyberbullying. We've had one just recently. Well, let's back it up. 2 months ago, we've had an incident where we had a student from Rutgers. There was a situation where information was leaked, video was somehow leaked onto the internet. Again, this is, it's all legal, so they have to find out the specifics. However, this individual committed suicide. He jumped off of the George Washington Bridge. But just recently we had a female from out west, an adolescent, cyberbullying, and committed suicide. So it's not an isolated incident. This is starting to happen across America. And because of technology, we have instant access. We can, years, if you go 20, 30 years ago, 40 years ago, there may have been something that happened that didn't make the media because they felt it didn't have enough hook to it. But with today, you can have an incident and you can type it and send it out, and there's going to be someone, some press will pick it up.
Yeah.
You know, they'll just do a press release, and there'll be someone out there that will pick it up.
Yeah, what are some of the causes as a physician, just from knowledge, not from your practice,
Right.
that would cause a teenager to commit suicide?
Well, let's just break it down that this phenomenon is brand new. Not the bullying, as we stated.
Yeah.
The bullying goes back from the beginning of time. It's been around. It's just the means, the way of the bullying, which is now cyber, meaning through technology. So there's really not enough statistics out because it's brand new and it's starting to study this.
Right.
We would have to separate cyberbullying and suicide. There is an overlap, and that overlap, the common denominator seems to be depression, some sort of mental pathology that overlaps, and there is statistically someone who's been cyberbullied. There's anywhere between 1.5 to 2 times the risk for either contemplating or attempting suicide. So a feeling of hopelessness, a feeling of helplessness, and a will to end one's life.
Well, you know, the person the bullier finds out this information. And there's where I think they cross over. They find out that this person does have a weakness.
Right, excellent.
That this person or has a sexual drive, or that this person is worrying about failing, or maybe this person has just had a child, teenagers involved in a family situation where there's a divorce and there's fighting in the house and whatnot. And then somebody finds that out, and they make it public. And our producer was just talking about it's all the way down to adolescence.
That's correct.
Children in school just playing games, sending picture of their classmate or of themselves to another classmate. That classmate takes it and spreads it all over the city, you know, and all through the school system. And that kid is ruined,
Right.
you know, and that kid could eventually go home one day and turn the gas on.
Right,
Yeah.
exactly.
So I'm just using how would you call the possibilities of how they cross over from cyber to suicide.
Right. Well, there's risk factors, and there are risk factors which increases the chance of wanting to commit suicide. Like I said, that from everything that I've read, what the common denominator is, there is a depression, some sort of mental or behavioral pathology. But what causes that?
Yeah.
Is it the actual cyberbullying that drove the person to become depressed?
Yeah.
Or was there some sort of external influence within the family, like someone was predispositioned to develop a depression? Like you said, you gave an example. There's a divorce, and so there's a lack of or a dysfunctional family.
Yeah.
So the person is on the verge, and like we call the tipping point, and then someone finds that weakness and uses it as leverage and pushes the person over the edge and beyond the tipping point.
Yeah.
So all these are factors that can help contribute or increase the risk for committing suicide or not committing, because if you commit suicide, it's over. There are a lot more teenagers that attempt suicide, and that's something that doesn't make the media.
No, but sometimes it's a factor within the family, or even with friends. I was reading something the other night, and some information that I got, that sometimes people talk about suicide and we take it for granted. Say, oh, I would like to end my life.
Right.
And you want to talk about that a little bit? Or they're saying, I'm not worth living.
Right.
And we say, don't worry about it. Or they may fantasize in suicide. We go find out that teenagers have a fascination with death.
Right. It's just like the fact that they fascinate with flames and burning,
Right.
Just something because it's unique. Good point that you made there. I'm just going to, from my perspective, and this is something that's important, and you don't have to be a physician, that when we are taught that if a patient comes in and they are contemplating suicide, suicidal ideologies, homicidal, they want to hurt someone, they want to hurt themselves, and they have a plan, they wrote it out, okay? That is a medical emergency. I must refer them to the ER. They need to be admitted. It's that serious. It's something not to take lightly. If the person refuses to go to the ER, I have the right to call 911 and have the police come and escort the person to the hospital. If I have to, we'll put them in handcuffs. That's how serious it is. So if you know anyone that is suffering, that's saying that they want to kill themselves, now you should be, you can know the difference between someone that's just joking around to someone that's their behavior has changed, their concentration, either the way they clothes, their hygiene, they isolate themselves, they're not involved in their favorite activities anymore. You've noticed a significant change in their behavior, and now they're wearing darker clothes. Everything changes. And now they're starting to talk about suicide. They have an idea, suicide ideologies, meaning they're thinking about it. They want to hurt themselves. They're starting to cut themselves. They're taking medications, more pills. You can see that they're starting to lead up to this. They're advancing. They need help immediately. Reach out. Make the call. If you're not sure what to do, you can call the Church Alive and ask for the bishop.
Right.
You can ask for me. You need to make that call. That person needs help. They need counseling immediately.
Well, this was a great program, and you feel like we've only done tip
Scratch
of the
the surface.
iceberg, or
Absolutely.
the surface rather. So you might I know we have a physician, someone. We have another sequel to this.
Right.
Okay.
Yeah. What I'll do is I'll bring in an expert who actually a psychiatrist, and then we'll really go over it from a psychiatric perspective. I'm only a family physician. I deal with it superficially, but someone who really is an expert. Well, I'd like to wrap up this show.
Yeah.
Bishop, thank you very much for being a guest. We had a
Right.
wonderful show.
Yeah, this has been good.
Yes.
Right.
All right. Well, I want to thank Church Alive Community Church. Remember, stay alive with Church Alive. God bless.